Good morning, everyone. It's November 21st at, oh my God, I don't even know what time it is. It's like 8 a.m., close to 8 a.m. I woke up a little while ago with a lot on my mind, and I wanted to discuss something that I really don't talk about very often. I want to talk about the connection between chronic illness and now cancer for me and mental health. Okay. So, first of all, I suffer from several different illnesses, okay? Not just the three that I speak about, which are Ehlers-Danlos, dysautonomia, and posterior orthostatic tachycardia syndrome. Ehlers-Danlos is a connective tissue disorder. POTS and dysautonomia are both autonomic nervous system disorders. In addition to those illnesses, I also deal with Addison's disease, adenomyosis, chronic pain, chronic nausea, and the list goes on, okay? But everything is comorbid, they're intermingled, and they do not play well together at all, okay? Do not. But some of the symptoms of the illnesses that I have mimic anxiety. They look like anxiety. So you go to the doctor, you tell them what's going on, they say it's anxiety. Okay, it's not anxiety, it's illness. But let me tell you something that's interesting. So being sick and being undiagnosed and not being in control of your body, having your body defy you, causes what? Anxiety. So in turn, we do have anxiety. We have anxiety because we're going to doctors who tell us it's anxiety, causing us to feel anxious, hence giving us anxiety. What kind of sense does that make? It's ridiculous. I also want to talk about feeling out of control and being sick. So I've been sick my entire life, okay? There are some people that are chronically ill that got sick 5 years ago and they've been chronically ill. Personally, I remember being a child and being very ill. Of course, I did not get diagnosed back then because they just thought that I was a child who got sick often. But it wasn't until I was an adult and able to verbalize exactly what I was feeling is when I started seeking out answers. And I got them, finally, I did. But I still think there are some things that are lurking and need to be checked out. So feeling out of control, this is very, very vulnerable for me to talk about, okay? I developed a very, very serious eating disorder because I felt very out of control. Very out of control. My body was doing things that I did not understand, and I could not control that. So in turn, I took control of what went in my mouth, what came out of my mouth, and what did not go in my mouth. And when I say what came out of my mouth, I mean bulimia, okay? I started off with anorexia. I got down to 89 pounds. Now I am 5'10" right now. No, not right now I'm 5'10". I am 5'10", but I've been 5'10" at 89 pounds, which is ridiculously thin. Now I'm around 120, 125 at 5'10", which is still very thin. You probably can't tell from the photographs, but I am very thin. I wear a size 2, a size extra small and small. That's really thin, okay? But that is not because of an eating disorder. That's because I've been sick, especially since the cancer diagnosis. I've lost weight. I was not heavy before. I was healthy, but I've lost weight. So the eating disorder, I I had the eating disorder for about 15 years. I spent a lot of money on my addiction. People don't realize that eating disorders are serious addictions. So I spent a lot of money, a lot of time, a lot of energy, and putting myself at risk for death because I felt out of control. Now it's been years since I've actively been in my eating disorder, but I still think about it, and I realize something. I think about it more often, and I've thought about it more often since being diagnosed with cancer. I also suffer with OCD, which is obsessive compulsive disorder. Now, I'm not just saying it like, oh, I like my shoes left to right, left to right. No. When I say I have OCD, I mean I seriously have OCD. I'm afraid to touch certain things. Certain things skeeve me out. I become afraid of small things like germs and mildew and mold. I wash my hands a lot. It goes beyond that. I'm not going to get into that. It's very complicated. If you don't have OCD, I'm so sorry. But I don't want to make this video very long. If you'd like, I can dedicate an entire video on OCD and explain it 1 to 100. You know what I'm saying? But there is a huge connection between illness and mental illness. That's it. That's really all I wanted to say. You know, so if you're dealing with something that makes you feel out of control, there's a good possibility that you're dealing with mental illness as well, mental health issues. And that's perfectly normal. But I recommend that if you are suffering with an addiction, to please go get help. Because without help, I would have died. Now, again, being diagnosed with cancer brought up a lot of my old feelings, including my food issues. It's like a monkey on my back at all times. I do not give in, but it's difficult because I have these crazy thoughts in my head and I cannot get rid of them. And I don't like it. But I do have something in my room that signifies the monkey on my back. So let me show it to you. All right, 1 second. Okay. See? There is a monkey on my fucking back. Do you see that? All right. Okay. Back to me. All right. So, that's all I wanted to say. I have that monkey trim on myself. No, no, no. Do not give in. The OCD is a lot better, thank God. I'm managing it with medication and with therapy. I'm talking about the food thoughts that I'm having, and I am in active therapy, and it's a constant battle because I still feel very out of control. I've spoken about this many times, feeling out of control. All right, I'm going to go give you guys a break from me. If you want to know anything else, ask me, DM me, comment, tell me what you want to know. I'll go into detail. I'm not ashamed of anything that I've done or do or what I go through. Okay? Please